watch your upper back muscles here, specifically your trapezius. Does it feel tight, swollen, and even bumpy? Those are called muscle knots and they can be painful. In this video, you will learn about a 1-minute technique that will get rid of your muscle knots. It is cost-effective, you can do it by yourself, and you can do it anytime, anywhere. Greetings again to everyone. This is again Doc Cherry, Doctor of Physical Therapy. If you're new here in my channel, please don't forget to click the subscribe and the bell button below so you will be a part of our growing community and you will receive weekly health videos on a weekend that will benefit our beloved seniors, you, and your loved ones. Muscle knots are these hard and painful part of your muscle, and although it can happen anywhere in your body, the most common part affected is your upper back and your neck. Muscle knots can be caused by many factors, but the most common cause of muscle knots is the wrong posture. I keep on reiterating this, that our aim should always be that our ear is at the level of our shoulder, especially now that most of us are always using computers and cell phones. We need to constantly remind ourselves with this until this becomes a habit, because if not, we will be assuming the forward head posture. If we do it like this, all the muscles in the back part of our neck and our upper back would continually work to overcome the pull of gravity, which will lead to muscle knots. Overuse injuries and staying in one position almost all throughout the day would also give you muscle knots, because generally your muscles work best if they are able to move in different positions. So if you just sit on your chair many hours of the day, you are more prone to having these tender and painful muscle knots in your upper back. Stress and anxiety can also give you painful muscle knots. Have you noticed that when your stress level is high, you are also most likely to experience upper back pain? This is because when you're stressed, your muscles tense up. This is a normal reaction of your body to prevent you from injury. However, prolonged tension in your muscles will give you these painful lumps around your trapezius. Prolonged tension of the muscles in your neck and upper back can lead to also to other conditions such as tension-type headaches and migraines, and these muscle knots are also common to those patients who have cervical radiculopathy. When we say cervical radiculopathy, these are those patients who experience neck pain. At the same time, they also have this numbness and tingling sensation in their hands. Common cause for this is with cervical spondylosis or cervical arthritis. If you are suffering from cervical spondylosis, I have a video that can help you treat that with home exercise programs that you can do conveniently at the comfort of your own homes. You can just click on this video here. Before we go to the 1-minute technique, if you have hot compress available in your house, that would be good. Any hot compress types would be good for you. Your goal is to use it for 20 minutes. The purpose of this hot compress is to improve the circulation in the painful part, as well as it relaxes your muscle before we try to move it or before we mobilize the fascia or the knot. I have talked to you about this hot compress with my previous videos. What I love with this is that it is flat and it can contour well to your neck and your upper back. It also has thermal settings which will prevent you from having burns. So before this 1-minute technique, we are going to use hot compress on your painful area for 20 minutes. This will boost circulation and it will help with your relaxation. So what I want you to do first is, for example, given that your affected part is in the right, so your muscle knot is in the right trapezius, you try to palpate that one first. So I want you to elevate your shoulder using your 2 fingers, put a firm pressure in the muscle knot, and then what you're going to do is you want to laterally flex your neck toward the side of the pain while pressing on your muscle knot. Slightly extend and rotate like this. So you want to turn to the opposite side. You want to maintain this deep pressure for 60 seconds or for 1 minute. The purpose of this is to block off circulation in the muscle knot and then to hopefully break it down. You try to release and then back to your position. So that's 1. But we are going to repeat it 3 times. So again, elevate your shoulder using your 2 fingers, put a firm pressure in the muscle knot, and then you laterally flex, extend, and look away. Maintain it for 60 seconds. Release. And then do it again for the last time. So elevate the shoulder using 2 fingers, palpate and press on the muscle knot, side bend your neck, extend, and look at the opposite side. You need to keep this pressure until the muscle knot softens. So you can do this any time of the day. This will block off circulation in the muscle knot and will slowly soften it. Then release. Next, I want you to relax. So that was our 1-minute technique. After, you need to relax, and what we're going to do is we just want to promote cervical range of motion to boost and to increase the circulation in your affected side. So just follow with me. First, we do cervical flexion extension like this. We want to repeat it 3 times. And then we do side bending on both sides. So with this, you are promoting circulation at the same time, the range of motion in your neck and your upper back muscles. This will feel good. And lastly, you can do cervical rotation. Just follow me. Lastly, what you can do is to get a cold compress like this. This is very inexpensive. You can purchase it in any pharmacies near your place. So what you can do is you put it in your affected part. You want to keep this for 10 to 15 minutes. Now, the purpose of the cold compress is to prevent delayed onset muscle soreness. I tell you, you need to try this because this will really help you a lot. So again, let me recap. The purpose of our hot compress is to improve circulation and to promote relaxation of your muscles. You do it 20 minutes before you do the 1-minute technique. Then after you do the 1-minute technique and the exercises, you do the cold compress. The purpose is to prevent delayed onset muscle soreness, and you want to keep it in the painful area for 15 minutes. Thank you very much for watching. I hope that you find this video helpful. If you do, I would really appreciate it if you would take 1 second of your time to press the like button to help with the YouTube algorithm. Should you have any questions regarding neck pain, Please don't forget to comment down below because I would really get back on you. Please share this video to your friends and family members so it can help them too. This is again Doc Sherry. Stay safe, stay healthy. God bless you.